Hey guys, just want to talk about how COVID's affecting us all. And we know it's affecting everybody in our country, but particularly here at home. It's affecting our hospital, it's affecting our surgeons, our nurses. It's putting a large stress on everybody here. We're running out of rooms, we're running out of resources.
I think our biggest challenge is getting the word out to the community and educating the community about the problems that we're having and educating the community about the things that we can do that have a realistic impact on limiting and lessening the spread of the disease.
COVID patients, to me, are the sickest patients that I've seen in the 28 years of critical care nursing that I have done. It takes every breath just for them to get up out of bed, to go to the bathroom. It takes all their reserve. They are literally the sickest patients I've had to take care of.
The biggest challenge for Henry County is expressing to my friends and family how bad COVID is and how life-threatening and how it's unlike anything we've seen in the ability to require so much oxygen. And if we could wear a mask and prevent just one person we come in contact with getting sick, it's so worth it.
We find ourselves out of beds, out of staff. Those two things collide and cause a significant issue for you, the patient.
The main thing that we're seeing in the ER is two complete opposite ends of the spectrum. You have patients that are coming in, and by the time they get to us, they have put off coming to the ER so long that they are very, very critically ill. Our biggest fear right now is for our hospital and our services being bogged down by patients who are getting this diagnosis and coming straight to the ER to confirm that diagnosis.
But people need to walk away with the idea that this, in certain people, is a very, very serious disease. It is a fatal disease. In the next 7 to 10 days, I'm sorry, but we're going to see deaths in this hospital. I know the caseload that's in the hospital right now and the age ranges and the severity of disease, and we're going to see some deaths in the next 7 to 10 days in this hospital.
If our numbers continue to increase, I worry about our ability to take care of our people here at home, our ability to send patients elsewhere, and it could come to a situation where we can't take care of the most simple illnesses and COVID. It really could be bad.
Education is very important right now. It is key to know when to seek higher level of care.
If you are starting to have symptoms, cough, headache, aches, stomach upset, fever, anything like that, you should consider that you should be tested. Now, whether you need to come into the clinic and possibly expose people and do that is one question. We've got all kind of capacity to test you in the parking lot or in remote sites where it's not so likely that you'll expose someone else. Just call your doctor. Just call. We get calls every day, and we answer those calls, and we help triage. You sound like you need to come in, and I need to listen to your chest, and we need to do a chest x-ray. Or you don't sound like you're so terribly ill, but my goodness, you could have COVID, and we need to make sure of what you have or don't have so that you don't spread it around. As far as going to the emergency room, the number one thing is if you have shortness of breath, if there's any shortness of breath, you should go to the emergency room and should not go somewhere else.
Out of beds, out of staff are two key things to know and to remember why it's important to mask up Henry County.
Mask up for Big Red, Henry County. We know you can do it.